What questions do we have for Jennifer? She answered them all for you, I can see, right? Nope, here we go.
If you and your colleagues ruled the world and could tell this committee what it ought to recommend with respect to stocking requirements, we would love to hear your ideas.
Well, I think a good place to start would be reviewing the expert panel report that was released earlier this year. A lot of work went into developing those recommendations, a lot of conversations with the expert panel members, which represented folks that work in small stores, academics, and also folks representing the small store industry. We spent a lot of time thinking about what would be feasible and trying to find a way to get started. And I think that the role for federal requirements is that, providing some minimum floor. And then the states can and should continue to go above and beyond that to set higher requirements that would reflect the needs of the WIC programs in their states. So I would take a look at the expert panel report, and especially the basic level recommendations as a starting point.
Yeah, I was just wondering if you could speak a little bit more about the different stocking requirements for peer groups. Are those the same peer groups that are used for the cost management? Do you know?
I don't know, but I would imagine that they would be.
Okay.
But I don't know for sure.
Can you expound on a little bit more on how those peer groupings are being used in terms of stocking requirements?
Sure. So typically what states would do is they set either 2 or 3 or 4 different peer groups. So an example, in Minnesota, we have all of the stores that are in our 7-county metro area surrounding the Twin Cities are in one peer group, and then the rest of the state is the second peer group. And the structure of the requirements would be the same for both peer groups, but the number of varieties and the depth of stock requirement would be higher in those stores that are serving the Twin Cities metro area as opposed to the more rural areas. And that would be a similar structure to what other states do when they sometimes will specify, stores with 1 to 3 cash registers have this level, 4 to 6 cash registers this level, 7, and then at each category they have increasing levels of minimum stock that are required. Does that answer your question? Sure.
I don't know that you had studied this, so there may be no answer that you have, but in the experience that you had in this committee and your work, what's happening with small stores and the transition to EBT?
I think I can give a partial answer there. So some small stores have the equipment and are able to process EBT, and other small stores don't have cash registers and technology that enable them to process EBT. So I can't speak to the specifics. I can just say it probably varies by store.
One more, quick. You talked a little bit about the challenges that small vendors have in terms of distribution. I know some small vendors sometimes sort of cooperate to build volume. Do you know if there's anything can you speak to that at all? Do you know if anything like that is going on, or a little bit?
I'm going to defer that question to our next speakers because
Okay,
I think
very
they are much more up to speed on those current efforts.
So we heard from one speaker previous speaker, that participants use their vouchers and their benefits in a different way depending on the store type. Do you have any experience about the differential use of small vendors and whether or not that might affect some of the results that you have on volume, or that you presented about volume redeemed, or what kinds of foods would be most likely to be redeemed there?
Sure. Well, I think it's important to recognize that these stores are fulfilling a different role in the WIC program than the supermarkets are. And I think the research I presented at the beginning is one more piece of this puzzle, that we are seeing that WIC beneficiaries are going to different stores for different reasons, with different frequency and purchasing different amounts of food at them. So I think it's appropriate that there would be lower stocking requirements for smaller stores, A, because of their small size, and B, because beneficiaries aren't expecting to go there and come out with, you know, a carload full of groceries. So I don't think we have the answer yet, and we've been looking for data in terms of, you know, what share of people's food that they buy in a week comes from small stores. We don't have that data yet. So it's still an unanswered question, but I think it's important to recognize that there's different use for different stores.
Thank you.
Thank you.
Very nice, Tom.